Welcome to Baptist Medical News. I'm Rhonda McRae. Thank you for joining us today for our live seminar. Our guest today is Dr. Amanda Nichols. Thank you for joining us today.
You're welcome. Happy to be here.
Thank you. She is an OBGYN and she is our expert and going to help us with the first OBGYN visit, how to choose an OBGYN, and what to expect. So thank you for doing that. At what age or at what point should a young girl first see the OBGYN?
Well, it's an individualized answer. The American College of Obstetrics and Gynecology recommends that young girls start seeing a gynecologist initially between the ages of 13 and 15. I don't absolutely think that's necessary for everyone, and I think most OBGYNs would agree with me. And actually some obstetrician gynecologists actually have an age limit where they won't see patients or don't see patients under the age of 17 or 18. I feel if you're having a problem between the ages of 13 and 15, you definitely need to come in and let us take a look and see if we can solve your problem.
When you say a problem, do you mean like a menstrual problem?
I do. Usually? I mean a menstrual problem as in irregular periods, very painful periods, or really anything else that you would be concerned about. But most people, I think, feel that the appropriate time to really come to the gynecologist is around age 18. Okay. You know, women who are sexually active or girls who are sexually active, they need to come in whenever that occurs, or even if they're thinking about having intercourse. You don't always have to have necessarily a pelvic exam or a pap smear when you come to the gynecologist. The new recommendations for pap smears are 3 years after you become sexually active or age 21, whichever comes first. However, many insurances will pay for pap smears before that time, so if you wanted to get a pap smear really around the age of 18, it would be appropriate.
Okay, all right, so 18, unless there's some sort of menstrual
problem,
issue that you need
and
to
then
see,
sooner.
But in general, at age 18, so if you're 18 and you haven't had your first appointment, you're watching the right webcast. All right, so Dr. Nichols, choosing an OBGYN, what should someone look for?
That can be difficult for people if you don't know one specifically. One way that you can find an OBGYN is just ask your family doctor, ask your pediatrician who they would recommend. Most of them have someone in mind that they generally refer to. Also ask your friends and family members, ask them who they go to, ask them, do they like their OBGYN? Does their OBGYN listen to all their concerns, address all their problems? Do they have a good bedside manner? And really word of mouth is a great way to find a doctor.
Okay. What about certifications or board certifications, credentials? Do you think that's all covered in asking family and friends, or is that something to be concerned about?
It is, and most of the time you can find that information online. For example, my clinic, the Women's Clinic, we have a website, www.twc-ms.com. You can go onto our website and we have photographs and profiles of all of our physicians, and you can go through our profiles, and that could be a helpful resource to find a physician.
Right, so ask friends and go online to
That's right.
kind of follow up on what you learned. That's a great idea. All right, so they've made the appointment, they're coming for the first visit. How do you want to do this? You want to start from the time they check in? Okay, well, let's go that way.
Yeah.
So here's what to expect on your first OBGYN visit.
Well, when you come to the doctor, really any physician's office, what you need to bring with you is number one, your identification and also your insurance card, because they're going to ask for that when you check in. At our particular office, when you check in, you'll be given an information sheet and you'll be asked to fill out all of your medical history, surgical history, and you'll be asked to describe any problems that you're having. Once the information sheet is complete, then you'll go to the lab where we generally get a urine specimen, check your height and weight, and generally blood pressure. Sometimes we do a finger prick and check the hemoglobin level also. And then after the lab is complete, then you'll go to an examination room or the physician's office, and the physician will go over your history form with you. And what we're going to ask, or what we're going to look at on the form and what we're going to talk to you about is basically, what is your past medical history? Do you have any medical problems? Have you ever had surgery before? If so, what type? We're going to want to know, what's your social history? Do you smoke? Do you drink alcohol? Any recreational drugs? Are you an exerciser? Do you take calcium? You know, what is your occupation? Are you a student? Just find out a little bit about you. We'll also want to know your obstetrical history, if you have an obstetrical history. Have you ever had a pregnancy before? Tell us about, you know, your prior deliveries. Have you ever had a miscarriage or an ectopic pregnancy? We'll also want to know about your gynecologic history. When was your last menstrual period? Are your periods regular? Are they normal? Is the flow normal? Are they particularly painful? Do you have pelvic pain with your periods or during the month? Do you have any history of gynecologic problems like endometriosis, ovarian cysts, fibroids, any urinary issues? We'll go over all those questions. We'll also want to know if you're sexually active, and if so, what kind of birth control method do you use? How many partners have you had? Those are important questions as well. And then we'll ask you if you have any complaints or any problems that we didn't cover that you want to go over. After we take a history, then we do generally a physical exam, and the physical exam that we do really depends on what we get out of the history. You know, if you're not having any problems and, you know, we need to just do an annual exam, generally we do a pelvic exam, a breast exam, and then just a brief general physical exam. If you're having any problems, pelvic pain, history of ovarian cysts, anything like that, you know, you may require an ultrasound or some further testing. But the physical exam generally includes a pelvic exam, possibly a pap smear, and then generally a breast exam also.
Okay.
And then after the physical exam is done, we'll go over, you know, any problems that you might have, the physical exam findings that we found during your exam, and then we'll come up with a treatment plan and discuss if you do need any treatment or medication, we'll discuss it at that time.
Okay. All right, so do you find that during that sort of conversation with the doctor and when you're getting the medical history, do you find that that might be a time when someone who's never been to the doctor before, it's an opportunity to help them get a little more at ease, make them feel a little more comfortable?
Absolutely, absolutely. And generally for initial patients, I take those women into my office rather than talking to them in the exam room. And I always talk to my patients before they get undressed, because I really feel like that makes them a little bit more comfortable.
Right. Yeah. Good plan. I think right now, Dr. Nichols, we've kind of covered just the basics. So before we get into any other sort of specific questions, I think I'm going to pause now and see if we have any questions from any viewer. So excuse me 1 second. I'm going to refresh this screen and get to that right now. I don't see any questions right now, so that must mean we're doing great. Let me follow up then. You know, many times young women are still on their parents' insurance. So their insurance is covering it, their parents may be paying the fees. In terms of confidentiality, how much information, medical information about this young woman do their parents have access to?
Right. When you are 18, you're legally an adult, and so all of your information is protected. We're actually, by law, not allowed to share any medical information with anyone else besides yourself, unless you sign a form stating that you want us to share your medical information with a spouse or parent or anybody else. However, if you're under the age of 18, your parents do have access to your information, and they actually have to consent to any treatment that you might have. So if you're under 18, then we definitely need your parents to be involved in the process and any decisions that we make.
Do you think it's, at that age, even 18 or older, do you think it's a good idea for of course it's an individual decision, but do you think it's a good idea for parents to have some information if their daughters choose to share that, or just...
Absolutely. I think the communication between an adolescent or college age girl and her parents, I think it's just very, very important. So I definitely think that even women who are over 18 who may still be on their parents' insurance, I think it is best to share information with your parents, because if you're still on their insurance, even though we can't share your medical files and your medical information with your parents, they're going to get a bill with basically the services that we rendered. Any tests that we might have ordered, you know, may be on that bill. And so I think it's best to have a dialogue with your parents and open communication so they'll know what's going on.
Right, but it's not required, and you certainly
That's right.
won't share it, but it's,
That's right.
you know, it has its advantages.
Absolutely.
Okay, all right. Well, most young women are relatively healthy. So why is it so important at such a young age to start doing this? I mean, why is it important if you're not having any problems to go ahead and start seeing the OBGYN at age 18?
Well, what we do, we not only deal with gynecologic issues and problems, but we also do a lot of screening tests and healthy checkups. You really need to see a physician annually, number one, to get your blood pressure checked. You know, we need to do a weight every year to make sure that you're maintaining a healthy weight. You know, when pap smears are appropriate, then we need to start doing those every year. We just need to make sure that you're making healthy choices in your life, like your eating habits are healthy and that your weight is appropriate. We check cholesterol levels to make sure that your lipids are normal. And to just really go over any concerns or any issues that might come up during the year.
So even at age 18, it's good to get a doctor on your side who
That's
knows
right.
your health and your habits that can help you.
Absolutely.
Okay.
And so if you have a physician that you go to every year that knows your history, that knows you well, if you have a problem that comes up at any time, you can usually get in and get your problem worked out with your doctor.
Mm-hmm. That's great. You say most young girls are still on their parents' insurance and they need to bring their insurance cards with them. Is that really all that's really involved in that? Just make sure they have their insurance cards from their parents with them when they come?
That's right.
Okay.
That's right. And we'll just make a copy of them and they'll get it back.
Okay. All right. This is another thing that's kind of out there right now. We all see the commercials about the HPV vaccine.
Absolutely.
Why don't we talk just a little bit about that, if you don't mind?
I don't
what
mind
it is, what it does, who should consider it.
Okay. Gardasil is a vaccine that is active against the HPV virus, or the human papillomavirus. There are over 100 types of the HPV virus, and Gardasil protects against 4 of those types: type 6, type 11, type 16, and type 18. Type 6 and 11 cause most cases of genital warts, and type 16 and type 18 are responsible for about 70% of the cases of cervical cancer in the United States. The vaccine is a 3-shot series, so you get 1 shot, then 2 months later you come back in for your second shot, and then 4 months after the second injection you come in for your last injection. I personally do recommend it to my patients. I think that it's a great development, and I think it's going to decrease cervical cancer and make a difference in the future. It's not a requirement. It's certainly optional, so you can choose to do it. You can choose not to do it. Most major insurance carriers do cover the Gardasil vaccine. But one important thing to point out, like I said before, there are over 100 types of HPV, and this vaccine only protects against 4 of those types. Now, those are probably the 4 that we really need protection against. But it's still, you still have to come in to get your pap smears every year, because you could get an infection with one of the other types of HPV, and so we need to know that. So you definitely still need to get pap smears even if you've had the Gardasil vaccine.
Now, the HPV vaccine, the HPV virus is spread, it's a sexually transmitted
Generally it is.
situation. girl who is not sexually active, does she need to consider the vaccine as well?
Absolutely. This is for, women who are sexually active, women who are not sexually active. Either way, it's a good idea, because ideally we vaccinate people who are not sexually active and who have not been exposed to this virus, so that we can get really into the prevention of contracting these types of HPV. Sometimes people are already exposed by the time they come in for the vaccine.
Mm-hmm.
So it's definitely better to get it before you get exposed or before that even becomes an issue.
Okay, good. Well, that kind of raises another question. Many girls will come to the OBGYN initially because they have chosen to become sexually active, maybe looking for birth control.
Mm-hmm.
But many girls do not choose to become sexually active
Right.
after college or into their 20s. We can't assume everyone does. Is it just as important for the young women who are not sexually active to come to the OBGYN?
Absolutely, because we want to talk to those women and make sure that they're healthy in all those other aspects that we talked about, their height and weight and blood pressure and all those things. But we also are there to educate and to be there for any issues that they might be having, menstrual irregularities or any problems like that. And really it's just a good idea to have a doctor that you can go to when you do have a problem, or when you are considering becoming sexually active. It's important to have a doctor there who you can talk to and who understands. And let me just say that abstinence definitely is the only 100% effective birth control, and it's also the only way to completely prevent sexually transmitted infections. So it's a wonderful option, and we definitely encourage that. But if people do choose the other road, we're there also for them and to help them choose a birth control method that's appropriate for them.
That's great. Well, I'm going to pause again for just to see if we have any viewer questions. So let me refresh this screen. Okay. All right. I think we're still doing good. So that raises a question for me, Dr. Nichols. If a young girl, college-age girl, she's made the appointment, it's the morning of the appointment, she's a little nervous, what would you tell her to help her become a little more confident, a little less nervous? What would you tell her to help her not be so frankly scared about coming to the doctor for the first time?
Well, if you have a lot of anxiety about coming to the gynecologist, and trust me, everybody does. Even women who have been coming for 20 years still have a lot of anxiety about going to the gynecologist. So, number one, it's completely normal. But when you get there, just let us know. Tell us that you're anxious. We can go over any concerns that you might have, and usually we can work through them. I can tell you that most of my patients, after their appointment, generally say, that's not near as bad as I thought it was going to be.
Yeah.
So, we're not there to torture you, we're there to help you. So, just share your concerns with us and we'll talk to you about it and try to tailor the visit to make you as comfortable as possible.
How long does a office visit usually last?
It just depends on your doctor. Usually about 45 minutes to an hour if we're on time and on schedule. Sometimes, babies come in the middle of clinic and, things come up and things happen, and we do run behind sometimes. And we do ask people to be understanding about that, but generally maybe about an hour or so.
Does it make any difference whether or not you eat before you come?
It depends. If you're coming for an annual exam and you would like for your cholesterol to be checked or your lipid profile to be checked, it's always best to be fasting. If you're coming in for a problem, then it's not necessarily required.
It might boil down to how nervous they are and if they want to eat.
That's right. That's right. I think it'd probably be best to eat some breakfast or some lunch before you come in.
Does it matter what time of day the appointment?
Absolutely not. We start seeing patients around 8:15 in the morning to 4:30 or so in the afternoon. So just whenever is convenient and best time for you.
Okay. Well, what about in the office filling out the paperwork, do they need to bring anything with them to help them with that other than the insurance card?
If you are on any medications, you need to make sure that you bring a list of your medications, the name of the medications, and the correct dosages and how many times a day you take it. That's always important. We always want that in our records. And also, a lot of young girls that come into our office don't really know their family history.
Right.
But most of the time their parents are with them, and so their parents can help them fill it out. But if your parents are not with you, you may want to ask your mother or father, are there any problems that do run in our family? Because that's important for us as well.
Well, if you're talking to the doctor, if you're a little bit uncomfortable sharing any information, what would you say to somebody that has a little bit of a problem, maybe opening up even about things that they might be scared about? Is this spot normal? Is this, is this that I'm experiencing normal? If they feel uncomfortable talking about those things, what do you tell them to help them tell you what you need to know?
Right. I always tell people that everything that they say in my office is completely confidential, and that, trust me, I have seen it before. I mean, this is when people come in, it's because they have a problem that they've never had before. This is new to them. They think they're abnormal, and that's generally just completely not true. I mean, we see these things day in and day out, and so nothing is going to surprise us at all.
Well, you start at age 18 unless there's some problem that you need to see about, and you see an OBGYN for the rest of your life, or?
Pretty much,
Okay.
pretty much, because, after, the menopausal years are very important because of, we need to talk about hormone replacement therapy. We need to make sure that they're not having any, postmenopausal bleeding or any problems like that. And breast health is so very important after around the age of 40. Women start getting mammograms at age 40. So it's very important for older women also to keep their annual appointments and continue to get pap smears and mammograms. Now, pap smears are not necessarily annual after a certain age. We can do them every other year. Sometimes we don't necessarily have to do a pap smear, but we still like to do pelvic exams to make sure there's no problems, and we definitely like to do breast exams and mammograms every year in older women.
Well, let's talk a little bit about the breast health. Some of our viewers may have a mother or an aunt or maybe even a sister, an older sister, who have had breast cancer. So for those viewers, talk about the part of the office visit that is the clinical breast exam and what information they need to know since they do have a relative with breast cancer.
You should really start doing self-breast exams really at any age, but especially around the age of 18. That way, if you do your own breast exam, you'll know your body, and if anything ever arises, you'll be able to pick it out and you'll be able to let us know that something is not right. For women who have a family history of breast cancer, as in a first-degree relative, a sister, mother, those women need to start getting mammograms 10 years prior to the age that their family member was diagnosed.
So if my mother was diagnosed with breast cancer at age 35.
You need to start getting mammograms at age 25.
Okay, all
and
right.
you definitely need to be doing your monthly self-breast exams as well.
All right, great. Well, I'm glad we had a chance to talk about that, because many times I think we associate the OBGYN with just the pelvic exams and so forth, but the clinical breast exam and the monitoring of the breast health needs to start right there too. Is that right, Dr. Nichols?
Absolutely.
Okay. Let me pause one more time and check for any viewer questions. Excuse me. I think we're still doing good, Dr. Nichols. I don't see any questions.
Okay.
So let's talk about, if we can, let's talk a little bit about options for birth control for young women who maybe they're planning to get married this spring or this in the fall. Let's talk a little bit about that.
I have had so many patients recently who are getting married this summer who are trying to make plans for birth control. And really, let me just encourage everyone who's getting married and wants to get on birth control. It's an issue that we don't need to think about the week before the wedding. We need to think about it several months before the wedding. Okay, so you need to make an appointment and come in and talk to us. But there are so many birth control options out there these days. We can generally find one that works very well. You know, there are always pills. Those are probably, you know, the oldest, most basic type of hormonal contraception. And there are so many different types of pills these days. The basic ones, you take 21 days of active pills and 7 days of inactive pills. There are newer ones that help you have a shorter, lighter period where you take 24 days of active pills and 4 days of inactive pills. And now there are even pills that you only have a period every 3 months, where you have 84 days of active pills and only a week of inactive pills. So there are tons of options, and even in those categories there are so many different ones with just slightly different estrogens, slightly different progestins, and so we can generally find one that's very well tolerated. Now, some women can't remember to take a pill every day, and if you can't remember to take it every day, it's not a good option for you at all. And so for women who can't remember to take a pill, or women who just don't want to take a pill, I recommend either the Ortho-Evra patch or the NuvaRing. The Ortho-Evra patch is a patch that you place on your skin. You wear the patch for a week, take it off, put on a new patch for a week, take it off, new patch. Do that for 3 total weeks, and then on the 4th week you take your patch off and you don't wear a patch, and that's the week you have your period. And then the NuvaRing is a ring that is, it kind of looks like plastic, but you insert it into the vagina, and it works just like birth control pills with a patch. It releases hormones and prevents ovulation the same way that birth control pills do, but the medication is delivered through your vagina instead of in pill form. So it's a great option for women who are on the go and cannot remember to get that pill taken or remember to do their patch. Complaints about the patch, some women complain of dermatitis or some itching at the area of the patch. More so African American women experience some skin changes, like in the color of their skin, and so I recommend to them that they rotate the patch to different areas. And I'm sure that most people have heard kind of the bad press about the patch causing an increased risk of blood clots and that type of thing. So if you have a family history of blood clots or anything like that, that's something you discuss with your doctor. But in general,
and that would be the reason for that good medical history right up front.
Absolutely.
I'm sorry, I didn't mean to interrupt you.
No, that's fine. But yes, that's a great point. That's the reason why you really need to know your family history. But I think that the patch is a fine option for some women. Some women elect to go with the Depo-Provera shot, which is a shot, an injection that you come into the office and get every 3 months. It's very convenient because you don't have to think about it except once every 3 months, and you just come in and we give you the shot. The shot has been shown to cause a small amount of weight gain in some women, so that's an issue for some.
Right.
But for women who just can't remember to do anything else, I think it's a good option. And then we also have now the implantable rod, which goes in your arm. It's an office procedure. We just slide the rod into the underside of your arm with kind of like a needle, and it lasts for 3 years.
Oh.
And so it's for women who are looking for a more permanent form of birth control. And then, of course, the intrauterine devices, the IUDs, like the Mirena and the Copper T, those are also options for women who are looking for long-term birth control. And then, of course, condoms are very important, too. If you can't take a hormonal form of birth control or don't want to take a hormonal form of birth control, you know, condoms are definitely an option. So there are just lots of things out there and lots of things to choose from, so we can generally find something that works.
If a woman chooses the hormonal, is there a period of adjustment? Do you need to, you said you don't need to think about this the week before you get married, so is there a period of adjustment there, and how it affects your how you feel and that kind of thing?
They affect women differently. The side effects of birth control are generally very mild. You know, some women experience nausea, headaches, breast tenderness, bloating, mood swings, but generally those are pretty mild. However, if you're one of the ones who's going to experience a negative side effect on the medicine, we need to know that months in advance so that we can find one that actually is well tolerated by you and that's not going to cause those problems, because we don't want a bloated or irritable bride.
On wedding day.
Definitely.
So that brings me to this question. Now, Dr. Nichols, if anybody is watching this either live or recorded later and they don't have an OBGYN, are you accepting patients if they wanted to contact you?
Absolutely. I'm definitely accepting new patients, and you can just call my office to make an appointment. It's the Women's Clinic. The number is 601-354-0869. And you can also go to our website, www.twc-ms.com. You can create an account and log in and actually schedule an appointment on the web.
Okay. Well, it looks like we're about to run out of time here, but let me also just say for anybody that's watching this, maybe you've got an OBGYN already, but maybe you're having other symptoms, you might need another physician. If you need help finding a physician here at Baptist, you can call our Baptist Health Line and talk to a nurse, and they can help you discuss your symptoms, and they can help you figure out what kind of physician you need to see. And that's a free service. You call the Baptist Health Line at 601-948-6262, or if you're not in the Jackson area, there's an 800 number. That's 1-800-948-6262. I think we probably need to wrap it up. Thank you so much, Dr. Nichols.
You're so welcome.
Great information. If anybody has any questions, get in touch with Dr. Nichols' office, or you
Absolutely.
can post them to our contact us on our website. We hope you'll tune in next month on July 8th at 12:15 Central Standard Time. We're going to have Dr. Douglas Harkins. He is a cardiologist. He's going to be talking to us about what it means if you have a family history of heart disease. So please tune in, and we thank you for joining us.